So, next speaker. Now it's VAC4EU that takes the word. So we will speak a bit of the behind the scenes of what has happened during these years, what worked and what didn't, and the representative of the. So we will do that with a representative of the principal investigators and the representative of the local experts, which are, let's say, somehow the cornerstone of the generation of evidence for VAC4EU. And, well, Susana, what should I say? I took some notes.
Finding another way to call me old.
Well, I don't know, you are just our light, I think. So that's, well, if you want to say that you're old, yes, please. I'm happy to join you as soon as possible. And you have over 3 decades of experience driving strategy and research programs for safety, risk management, development, real-world evidence, and regulatory activities, applying public health and epidemiology methods. And you are also very active in all the networks that I know. You are always leading, and you are always putting time and energy. And I will just mention, of course, the International Society of Pharmacoepidemiology, the steering committee of the European Medicines Agency of the NCEP. You have co-led the development of the ISPI Good Pharmacoepidemiology Practice, the NCEP Research Standards, and yeah, so that's Susana.
Thank you. Thank you so much. Coming up? Okay, thank you. Happy birthday to all of us, of course, and it's a pleasure to be here in Brussels to share the perspectives of a PI center within the VAC4EU community. And I'm going to talk a little bit about what the PI centers do. So going back to before communicating, we need to get the best possible science, and what our journey was at RTI, and then share some lessons learned and some thoughts about the future, if I can now advance the slides. Okay, good. So the role of a PI center is, the PI center is the responsible for the scientific, I don't know what's happening, that's a stress test, I guess, for the scientific leadership and the conduct of the study in collaboration with all the other research centers in the VAC4EU community, and directly also with the marketing authorization applicant or holder, and a bit more indirectly through the communications of the marketing authorization holder applicant with the regulatory authorities that are driving the conduct of the study in the case of regulatory studies. In a nutshell, PI centers are responsible for the study to be implemented according to the protocol and to all the procedures and guidances, both within VAC4EU and the applicable data sources and in international. A key element of the VAC4EU environment is that when you volunteer yourself to become a PI center, you're also committing to participate in the regular working group meetings of the principal investigators that brings together everyone in that role working at current studies that are ongoing within VAC4EU. And of course, the PI Center is only one piece of the VAC4EU community, and we work very closely with the working groups and with specific members that are in the other roles. We have working groups for statistics and methods, for project management and contracting, as has been already discussed, the centers that have expertise and access to data are absolutely critical. And then there's, over the course of these years, there have been specific task forces developed for topics that were of interest and impact for all the portfolio within the VAC4EU research list. Thanks to the Secretariat for handing over a list of the many studies. You have seen a different version of this from Miriam's presentation. Here is that for every study you have PI or co-PI centers, and the centers that have been in this role include Aarhus University, Julius Clinical, LAREP in the Netherlands, UMC Utrecht, University of Bordeaux, the Spanish Medicines Agency, RTI Health Solutions, Art Toscana, and the University of Verona. So I'm giving you one perspective, which was ours, but there's many other centers that have contributed to the scientific leadership as PI centers or co-PI centers in VAC4EU. Our journey started with the closing of the advanced project, because we hadn't been working in vaccines that much. And Miriam invited us and said, well, we don't have any data, a specific data source access. And she said, well, we also need centers that have strong methods expertise and are excellent at running multi-data source studies. So we went there 2019, and we became members very soon, and obviously then we joined the community. Our first activity was indeed not data related. It was in the EMA-funded Access project to prepare the protocol templates. We were extremely active in there. And that was kind of jumping into the field with the rest of the community in a very active way. And we ended up co-PIing or PIing 3 of the 4 large early pandemic vaccine programs, and now a more recent study. But because we also have colleagues in the Atlantic, on the other side of the Atlantic, we were also involved in studies in collaboration with the US CBER division, and as well as some in collaboration with Harold Pilgrim Healthcare Institute with some of the sponsored vaccine studies as well. So we want to think that we contributed to the transatlantic connections and lessons learned early on in the pandemic by working across all these areas. What we have learned is I mean, nothing new in this audience. Early collaboration and constant communication is essential. I cannot emphasize the critical success factors of EMA spearheading this development of protocols that became the basis not only for protocols for vaccine safety, effectiveness, and other coverage in Europe, in the European Union and in Europe, but they became used across the world. And being able to jump into the vaccine studies, not having to worry about the skeleton, then there was a lot of adjustments and so forth. But when we look back, it was, I think, as I said, a critical success factor. Working together in the VAC4EU ecosystem allowed us to share issues, brainstorm on issues, brainstorm on solution. We had to, of course, and also develop tools and process development, because at the time it was early days. The readiness was for a very different disease. And so it was a very dynamic and learning environment. It was a steep and also very asymmetric learning curve, because each of the centers was coming from different experience, bringing a lot of expertise, but also bringing different gaps in what we had or had not done. We all needed to learn about the disease, about the roles and responsibilities within the VAC4EU community, processes, and as it has emphasized the value of the conception harmonization pipeline, which is research question driven. That was also learning for all of us, and also starting to adapt that tool that had been developed for a very different population. Basically to the broader population that was using vaccines. our team being based in Barcelona, very densely population city, hit very early and very dramatically by the pandemic. But everybody else in the team in VAC4EU, we were dealing with the pandemic ourselves at a personal and professional level. I remember going into everybody at the same time moving to a remote environment. Suddenly we're thinking, my God, 7,000 people moving to working remotely in my institute. Are the servers going to crash? And we were all, and I think this happened across institutions. Also, colleagues getting very, very sick, not being able to get to hospital. I mean, all of this is something that now maybe we forget the bad times, but I think that living all of this together with purposeful studies, with research goals, I think it gave us a sense of purpose and a drive to move through these very challenging times and address all the challenges that came along. We've talked about data. I think this pandemic was one of the first situations where we suddenly had to work with the whole population because you were either vaccinated or unvaccinated. And I know many colleagues in the room working with data, servers started crashing, even just trying to do basic population selection, matching, let alone talking about bootstrapping and other complex methods. A big challenge was also the data releases. Institutions holding data, people were also getting sick and pulled into a lot of medical and nursing personnel was pulled away from the research roles and moved into actual care. So data arrived late, sometimes the data sets arrived incomplete. We tried to work with synthetic data and we learned a lot because then the programs crashed because that particular case was not represented in the synthetic data. Of course, without saying, we worked on definitions, coding, the catalog, so lots of things. But I truly think we couldn't have, and all of this under the time pressure, not only the regulatory, in the case for regulatory studies, 6-month period, but the vaccines were in use by massive amount of population, and for once it was our family, all of us, the neighbors, so that it's the one time, I think, as a researcher, that we felt that what we're doing has direct implications for patients, but also by the community at large. So, what is next? How ready are we for a future pandemic, which nobody wants to, but obviously we need to be thinking about? I think that we have under the belt a massive experience in planning, implementing critical studies in a pandemic setting. I think the pharmacoepidemiology, real-world evidence methods, as part of a large evolution over the last couple of decades, very often in safety, we have robust methods, robust frameworks like the target trial emulation frameworks. We have lots of regulatory guidance, a lot more specifications. So I think there we are on a safe foot, at least not to make what has been called self-inflicted design errors with the data that we have. We all have learned we need to build on increased staffing and infrastructure and have clarity of roles, responsibilities, and learning on processes and tools. I think the big dependence, as it has been mentioned already, is the data quality and the timeliness. And as always, and this has been, I hope it doesn't sound trite, but this is certainly one of the most repeated proverbs mentioned, that working together is the best way forward. And I found this image, if you want to go fast, go alone. If you want to go far, go together, which has been much quoted. Not that we looked anything close like this rowers at the beginning of the pandemic, but now we're starting to go in that direction.